Hi, can I come in?
Yes.
Alright. Hi there, my name is Anna. I'll be your nurse for today. Very nice to meet you. Privacy. Can you tell me your full name and date of birth for me, please?
Yeah, Melissa Sorrell, date of birth, February 3rd, 2004.
Okay. And do you know why we're here today?
Yeah, to do vital signs and a full head to toe.
Okay. Do you know who the president is?
Yeah, Donald Trump.
Alright. So patient is alert and oriented times 3. I'm going to start off by taking your vital signs. So can I have your index finger, please? Or middle. That's fine too. I'm going to go ahead and start wrapping this cuff around. Just a few questions to start off. Any allergies to food or medication?
No.
Any family history of any chronic diseases?
No.
Diabetes, hypertension,
No.
heart failure? Okay. Any personal history of any of those diseases?
No.
Okay. Any underlying concerns that you want to talk about today with the physician?
No, I have no pain. No.
Okay. I'm going to put this under the... Okay. Relax your arm for me. I'm going to go ahead and start taking your blood pressure. Alright. So far I can see that your blood pressure is 117/78, which is looking pretty good. And I can see that your oxygen is also at a 98%, which is also good within range. I'm going to go ahead and start taking a pulse on you and also take some respiration rates. Your wrist. At this point, I would take the pulse for about 60 seconds and also look at your respiration rates for 60 seconds. Your normal respiration rate is about 16 breaths per minute, and your pulse is 76 beats per minute. So now I'm going to go ahead and take a quick temperature on you, okay? Under your tongue. Okay, 96.3, which is within normal range. You have good body temperature at the moment. Now that I am assessing body temperature, I'm going to palpate your body just to make sure the temperature is evenly distributed. So I'm going to go ahead and touch your face if that's okay. 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 Okay, upper lower extremities are nice and even to temperature. And face is also nice temperature as well. I'm going to go ahead and start the assessment off by palpating your head for any lumps or discharge. Just from the visual look of it, I don't see any discharge, lumps, edema, no central cyanosis spotted, no peripheral cyanosis. Everything's looking nice and normal. And I'm going to go ahead and palpate. Okay. No palpated lumps felt. Now I'm going to go ahead and start taking a look at your eyes. So look straight ahead for me. Okay. Both eyes have the pupils equal, round, reactive to light, and accommodation. Now I'm going to go ahead and keep testing your eyes by having you cover one of your eyes for me, please. And I'm going to test your peripheral vision first, okay? So let me know when you see it.
I can see. I can see. I can see.
Other eye?
I can see. I can see. I can see. Yeah, I can see.
All right. Now I'm going to have you put your index finger on your nose and touch my pen light as many times as you can. Okay. So coordination's nice and even. I can see that your eyes were following the pen light evenly. Now I'm going to test you 6 cardinal signs within your eye movement, okay? So follow the pen. Do not move your head for me, please. Okay. So eyes were moving without difficulty. I don't see any twitching. Sclera is nice and white. And I'm going to go ahead and check your conjunctiva. Okay, nice and moist. I don't see any discharge fluid or any abnormalities there. Now I'm going to go ahead and check your nasal for the same thing. I always use my pen light. Okay. So just go ahead and look up for me, please. I'm going to look inside your nose. Okay. Nice pink, moist. I don't see any discharge or abnormalities. And I'm going to palpate your sinuses for inflammation. Okay. No inflammation there. Did you feel any pain when I was doing that? Okay. So now I'm going to go ahead and test your mouth, okay? I'm just going to go ahead and take a look. Just go open real wide for me and say, ah. Okay. Stick out your tongue for me as much as you can, and I'm going to check your tonsils. Okay. I can see that your tonsils are a grade 3+, and oral mucosa is nice, moist, no lesions, no abnormalities. I'm going to dispose of this. and tongue movement is nice and even. I don't see any difficulties there. Now I'm gonna go ahead and look at your ears. I can see that your ears are nice and symmetrical. Upon palpation, no lumps or any visibilities there. And I'm gonna go ahead and do a little bit of a test on your ears. So I'm gonna go ahead and do a whisper test on you first. Okay, I'm gonna whisper something, tell me what you hear.
Strawberry.
Okay.
Purple.
Alright. Now I'm gonna be doing the Ryan and Weber test. The Ryan test, I'll be testing it next to your ear and behind your ear on both sides, okay?
I can hear it.
Can you hear it? Okay. Back side?
I hear it louder.
Which do you
next to
hear
my
louder?
ear. Next to my ear.
Okay. Next side.
I can hear it. If it's louder next to my ear.
Okay. And now I'm gonna do it in the middle of your head now. Let me know if it's evenly distributed or louder on one side.
In the middle.
Okay. Gotcha. Alright, so everything with hearing is nice and even. I'm gonna go ahead and start testing for facial sensation now. So go ahead and close your eyes for me, and I'm gonna have you tell me if it's either sharp or dull.
Sharp. Dull. Sharp.
Okay, I'm doing your upper extremities as well. Keep your eyes closed.
Sharp. Sharp.
Okay.
Dull. Sharp.
Okay. So I see sensation within upper, lower extremities are even in face. I'm gonna have you test your facial movements. Okay. So puff up your cheeks for me. Smile. Squint. Okay. And now I'll have you move your head up and down for me, side to side. All right. Facial movements are nice and even. No difficulty spotted. So now I'm gonna take a look at your neck. I'm gonna have you go ahead and look up for me. I'm gonna palpate your lymph nodes. Okay. No inflammation palpated. Then I'm gonna have you turn to the side for me and palpate your thyroid gland. Okay. Turn your head to the side and swallow. Other side. Okay. Then I'm gonna push it against your shoulders and just want you to go ahead and push against me, okay? Good. Now I'm gonna go ahead and check for skin turgor. Okay? No tenting. That means you're very well hydrated at the moment, so that's very good. Now I'm gonna go ahead and check for JVD at the moment, so jugular vein distension. I don't see any visible jugular vein distension at the moment, so now I'm gonna go ahead and go into the cardiovascular system. So I'm just inspecting, everything looks good. I'm gonna go ahead and auscultate your heart sounds, okay? Okay, I'm gonna auscultate apical pulse. Okay, now I'm gonna auscultate the jugular veins. The carotid arteries. Okay, now that I auscultated the arteries and the heart sounds, I'm gonna palpate all your pulses, okay? So I'm gonna start with the carotid pulse. Temporal. Brachial. Okay, I did radial already, but just checking for both sides to make sure it's even. I would check for femoral and inguinal in case of the provider needed it, but I'm going behind your popliteal now. Dorsal pedis. And then posterior tibialis. And then I'm gonna go ahead and check for capillary refill, okay? So can I get your nails? Okay. So capillary refill less than 2 seconds. Everything's looking good for cardio. I'm gonna go ahead and move into your respiratory system now. And I'm gonna go ahead and inspect, and I'm gonna palpate. Okay, percuss. And I'm gonna go ahead and auscultate your breath sounds as well. Okay, now I'm gonna check for symmetrical expansion. So I'm gonna go ahead and press under your chest, and I want you to take 2 deep breaths in, okay? Okay, expansion is nice and symmetrical on that side, and then I'm actually gonna check for tactile femoris on the front side. So every time I press on you, say 99.
99.
Okay, I'm gonna have you turn around, and I'm gonna do the same exact thing on the back side. So everything's looking nice and normal. Gonna palpate, percuss, and auscultate. Okay, lift up your arm. I'm gonna do the 3 on the right side for your right lobes, 2 on the left lobes. And I'm also gonna check for symmetrical expansion. Take a deep breath in when I press. One more time. And then I'll do tactile femoris again. Say 99 when I press.
99, 99, 99.
Okay. Everything's looking nice and good for your respiratory system at the moment. So now I'm gonna move over to your abdominal system, okay? I'm gonna lay you down. And just lay back. Any pain when moving at all?
No.
Okay. So can I go ahead and expose your belly? Alright, so upon inspection, I see that the abdomen area is nice and even, hair evenly distributed. Now I'm gonna go ahead and auscultate your abdomen, okay? I'm gonna auscultate on all 4 regions. Now I'm gonna auscultate your main arteries. I'm gonna go ahead and do your aorta, renal, iliac, and your femoral, which is a little bit lower on the side. Okay. I don't hear any swishing of the arteries, so everything's sounding good so far. And bowel movements are heard in about 3 quadrants. I don't hear anything on your lower right at the moment, but everything's nice and normal. So I'm gonna go ahead and percuss. Light palpation. Now deep palpation. And is it okay if I palpate your bladder?
Yeah.
Okay. Okay. You can go ahead and do that for me, please. And then actually I'm just gonna raise you up just a little bit to do a little bit of a neuro exam on you. Okay. Okay. Right there. So what I'm gonna have you do is I'm gonna have you move your heel from your up, down 3 times, heel to shin, okay? Same thing. Okay, now I'll have you sit up. Alright, so now I'm gonna go ahead and test for your rapid movements. So I'm gonna go ahead and have you just in, out very fast for 6 seconds. Okay, same thing with your feet. Okay, you can go ahead and sit back down. Then I'll have you close your eyes and I want you to see if you can interpret what I hand you in your hands, okay? Close your eyes, hand out. What is that?
The tongue depressor.
Okay.
Or a little cotton ball.
Yes, cotton ball. And then I'm gonna write something on your hand, and I want to see if we can identify it.
Okay. 8.
Okay.
9.
Yes. Okay. So you can go ahead and open your eyes. I'm gonna go ahead and start checking for your reflexes. So I'm gonna go ahead and go on your biceps. You can relax your arm on my arm. Ready? Okay. Okay, now I'm going to do your popliteal reflexes. Okay. Okay. So I see that reflexes are nice and evenly distributed upper and lower extremities. So then I'm going to have you stand up for me, please. And actually, if you don't mind walking back and forth from the curtain to me, you can stand right there for me. So I can see that the gait is nice and even. I don't see any difficulties. I'm going to perform a Romberg test on you, so I'll have you close your eyes, and then I'll have you just stand there for a few seconds. Okay? No visible swing, no difficulties. Your coordination and balance look really nice. Then I'm going to go ahead and check out your range of motion for your whole body. So do you mind squatting for me? Okay. Can you rotate your arms like this? Okay, up, down, side to side for the hips.
Yeah.
Okay. You can go ahead and have a seat for me, please. Of course. Alright. So now that we did the head to toe examination, your provider should be in shortly to see you. I'm just gonna go ahead and place everything back to its normal positioning. And do you have any concerns for me? Anything
No.
you want to bring up? Okay. And then I'm going to do hand hygiene. Place the call bell right next to you in case you need it. In case you do need anything, my name is Anna. Just let me know in case you do. And it should be able to see you shortly.
Thank you.
Of course.